All right, good morning. Now the last three gentlemen, we had their website. Oh no, we had you guys.
Yeah.
Have you seen yourself?
Yeah.
That's right, you're the three kings.
Not that way.
Oh, that's right.
Yeah.
Wait a minute, the guy in the middle has gotten very much heavier than last time.
Yeah.
What kind of surgery is this, Dr. Rutledge? You're okay. All right, well, so I guess you're not the three kings. We'll have to think of a term.
2 out of 3.
2 out of 3 kings, right. And a jack? Not a queen, right?
Yeah, as I said, better than a queen.
That's right. 10 of clubs. All right, well, good morning. I guess, now, last we heard from you, Bill. Do you want to say hi? We saw you the morning after surgery.
Yes, you did.
And I had a few emails from you that your week was a little bit rough.
A little bit.
Yeah.
Some muscular pain
Yeah.
in my neck and shoulders, and then still in this shoulder is
It's
just
still hurting.
brutal.
You mean
that's
mild pain?
Very brutally mild. But
Point out where to cut
But the gut feels great.
My part of
Yes,
the surgery.
yesterday was the first day that I really felt good,
Starting to come back to your old
yeah.
self. And yes, let's see, your surgery was Wednesday?
Yes,
So you are now
6 days.
6 days. So on the 5th day, you finally started to get back.
Right.
And that's terrible because what we would like is to have a perfect recovery with no pain. On the other hand, 4 or 5 days of some brutal, mild discomfort.
It was not bad. None of it was bad, except for whatever's going on up there.
Right, okay. And that whatever, the shoulder is me. In other words, it is the surgery. It's called referred pain. And let's talk a little bit about referred pain. You know probably the stories of people who have their foot taken off and they say, my foot hurts. Well, that's because the nerve that's sending the signal is still intact. It's still being stimulated, but it's not from the actual foot. So when you have shoulder pain after my surgery, it makes sense to think, well, maybe my shoulder hurts. It turns out, probably it doesn't. And I'll tell you a story. One of my patients, a very polite young woman, very nice, actually older woman. And when I came in the morning after surgery, she was super nice to me. Dr. Rutledge, you're wonderful. Thank you for doing my surgery. I think you broke my arm. No, I didn't break your arm. She says, no, I understand. Maybe when you were moving me from the table, you dropped me. These things can happen. I don't want you to feel defensive about it, but my arm is broken. And I said, no, we didn't break your arm, you know. And she says, look, I can tell you 6 months ago I had a broken arm, and this is what it feels like. I need an orthopedic surgeon. I'm not angry at you, but I have a broken arm. And what we did is, of course, we had her evaluated. She didn't have a broken arm, but it felt like it, and that's the referred pain. If you think about it, our fingertips are filled with hundreds of thousands of different nerve receptors, so our fingers can tell the difference between warm and cold, wet and dry, sharp and dull, soft and hard, and a tremendous amount of information. But when the nerves were created for the abdomen, the chest, and the shoulder, it's all one nerve. So if you've ever heard of somebody getting a heart attack, sometimes their shoulder or their jaw hurts or the pain radiates down the arm, that's the same nerve. That shoulder, chest, and left abdomen, where your stomach is, all refer to that same area. So what happens is when we crush and staple and sew the stomach, a raw, stapled edge of stomach rubs on the inferior phrenic nerve, and it refers that pain up to that shoulder. And if there's some blood there, that pain can last, in some people, up to weeks or months. Fortunately, that's uncommon, but it's nice to hear yours is improving a little.